Good afternoon, everyone. I'm Citina Liang, and today I'm going to talk about the project modeling the impact of COVID-19 on the HIV epidemic in San Francisco County. So we have all know that COVID-19 has disrupted our daily life for the past few years. And maybe what we don't know is that it has also heavily impacted the healthcare resources allocations, and especially those for intended for some diseases such as HIV and AIDS. And some published literatures has shown that COVID-19 has disrupted HIV prevention, testing, and also access to treatment. So it has raised the public attention on if we can still reach the ending the HIV epidemic goals, which is an initiative proposed by the US government in 2019. And to determine if we can still reach the goals and also to quantify the impacts of COVID-19 on HIV epidemic, we built a micro simulation model. So micro simulation model is a discrete time Markovian model that tracks individual health states over time. And this type of model is able to capture complex disease dynamics and also able to test hypothetical interventions. To make sure to ensure our model accuracy, we work with the San Francisco Department of Public Health. We gathered empirical data from both them and also published literatures. This is our model schematic. Susceptible individuals start with either not on PrEP or on PrEP, and where PrEP is a HIV prevention medication. And following the HIV infection, individuals can be undiagnosed, or they can be diagnosed after receiving the HIV testing. And if they receive the HIV test and diagnosed, they can start treatment. And by taking the HIV treatment, they can reach the viral suppression state. However, as a irreversible infectious disease, people even under treatment will just slow down the progress of the disease. People will eventually move to a more severe stage. And so after building this model to ensure that the model captures the historical trends of the disease dynamics, we also did model calibration and validation. And so on top of the model, we have COVID-19 effects, and mainly in four aspects. The first is the reduction in the HIV care initiation, and also there's also a reduction in HIV care retention. And the next is there's also reduction in sexual behavior, and the model also captures the COVID-19 related deaths. Here are the sources. Okay, so the first scenario we model is that we assume that COVID had never happened. So it's called non-COVID counterfactual. And our next question is, what if COVID, the timing of the returning to pre-COVID service. So we tested either the pre-COVID service can be restored by 2022 or by 2025. And our next question is, what if we only have sufficient resources for part of the population? So we can either prioritize the care for existing patients, or we can prioritize the care for new or potential patients. Yeah, so in this different scenarios, we do this by tuning the COVID effects on the right-hand side in the table. And here's the result. And we measure 4 cumulative health outcomes. And so here we compare the timing. So the blue bar is the earlier, quicker return. And we can see that for quicker return, we have fewer cumulative incident cases, fewer death cases, and also we lose fewer people, fewer PrEP person years and fewer viral suppression person years. And for the prioritization scenarios, the incident cases is indifferent. However, prioritizing care for existing patients will result in fewer death cases, and for PrEP person years and well as virus suppression person years, the result is opposite in these two cases. So in conclusion, after the service back to pre-COVID level, the health outcomes will restore quickly. However, the cumulative difference is still very measurable, and so there's still huge impact of the COVID pandemic on HIV. And our model also tells us that a quicker return is better, and also for the prioritization scenarios, it depends on what the policymakers will value more, and they can choose either one. And yeah, the last is the impact on the ESG goals will only impact the PrEP coverage goal in those two scenarios. Yeah, thank you.